education.
In other news, it is a drug that promises to reverse hair loss for men, but is it worth the risk?
2 investigator Pam Zekman reports on men who say they've been devastated by a side effect of the baldness drug Propecia. And we want to warn you of the adult subject matter in this story.
I feel like, my 20s have been taken away from me, and it's not fair. I wouldn't wish this on anybody.
22-year-old Tom was prescribed Propecia to battle his thinning hair. He says sexual side effects started the first day he used the drug.
I wasn't able to get an erection, or it took me a very long time. I can't maintain an erection now.
At the time Tom started taking Propecia, the package insert said that less than 2% of the men who took the drug had sexual side effects, and those went away after the patient stopped taking the drug. But it's been 2 years since Tom last took Propecia, and his problem continues.
Yeah, I basically feel like my penis and brain are not connected anymore.
That's not surprising, according to a recent study.
Yeah, the novel part about this study was that it is the first study to describe persistent sexual dysfunction after stopping the medicine, whereas previous studies have all reported that there have been reversible sexual side effects.
Lawsuits have been filed against Merck, the maker of Propecia, in both Canada and the U.S.
The warnings that came with this drug did not adequately tell the potential users of the drug what to be aware of.
Randy's family joined the lawsuit after their son killed himself.
He hated all the things that the drug had done to him. He hoped his family and friends would understand why he didn't want to live anymore.
In my own practice, I see probably a half dozen patients a year who come in with the observation, hey, I was feeling fine, I went on this medication, and after that, I noticed these changes in my sexual health.
Dr. Brannigan says there needs to be a long-term study of Propecia.
It's always been a question in my mind, was this a lingering drug effect, or are there other factors coming into play?
I wouldn't trade my hair for not being able to have sex, and that's just kind of a no-brainer.
Merck recently changed the wording on their label to acknowledge reports of sexual dysfunction even after people stopped taking the drug. A Merck spokesman disputes the findings in Dr. Irwig's study. He says Propecia passed 3 clinical trials before the drug was approved, and that once men stop taking it, the sexual side effects go away. And Robin Kate, the Merck spokesman, says they're going to vigorously fight those lawsuits.
It's hard to know whether it's the label or the spokesman that's right.
That's right. There seems to be a conflict there, and the best advice that we can give is that people should talk to their doctor if they're thinking about taking this drug.
All right. Thanks so much, Pam.
Well, here's a question. Are there problems with the